Hello everyone. Today we will discuss about sebaceous cyst. The sebaceous cyst is also known as wen. It is a true retention cyst of the sebaceous gland. It is less common than epidermoid cyst, a benign retention cyst arising from obstruction of the sebaceous gland duct. This results in accumulation of sebum within the gland, lined by epithelium resembling sebaceous duct epithelium and filled with sebum. Obstruction of sebaceous cyst due to inflammation or trauma is the main cause. Continued secretion of sebum by the gland, resulting in progressive dilation of the gland, forming a cyst. Demodex folliculorum, a commensal mite inhibiting the hair follicles and sebaceous glands, has been implicated in ductal blockage and chronic inflammation, especially in scalp and facial lesions. What is the pathogenesis? Gross pathology will seem like a well-defined cystic lesion with the contents oily, greasy, and yellowish sebum, usually non-foul smelling. Microscopically, the cyst wall will be lined by sebaceous duct type epithelium, sebaceous gland present in the cyst wall, and lumen is filled with sebum. Absence of laminated keratin flakes. The commonest sites include scalp, face, neck, scrotum, and sebaceous cysts are uncommon on trunk and extremities. Scrotal sebaceous cyst. Common due to rich sebaceous glands, often multiple and cosmetic concern. Clinical features include slow growing, painless swelling, usually solitary, smooth, dome-shaped swelling beneath the skin. Overlying skin is normal. Punctum may be present, representing blocked sebaceous duct opening. Soft to cystic consistency. Pain and tenderness occur only when it is infected. Examination. In the inspection, we will see a well circumscribed round swelling. Overlying skin is normal. A punctum may be seen. In palpation, there will be a soft to cystic swelling, freely mobile over the deeper structures, usually not firmly adherent to the skin and non-tender unless it is infected. We can do Paget's test where the sebaceous cyst is non-transluminant, helping to differentiate it from cystic swellings containing clear fluid. The punctum represents a blocked opening of the sebaceous duct. On pressure, oily sebum may be expressed. Its presence helps localize the lesion to a skin appendage or origin. Fordyce's disease. Heteroscopic sebaceous gland in the mucosa of the lip and oral cavity. Hair loss over the surface is common due to the constant pressure over the hair follicle roots. Unpleasant odor of sebum content is also typical. Secondary infection and abscess formation are the main complications, and there can be rupture with inflammatory reaction. Sebaceous horn, where there will be excessive keratinization over the cyst, forming a horn-like projection. Cox peculiar tumor is a proliferative lesion arising from the sebaceous cyst. There is a very rare chance of malignant transformation. The differential diagnosis include epidermoid cyst, triclamal cyst, dermoid cyst, lipoma, and abscess when it is infected. So the differential diagnosis mainly between a sequestration dermoid and sebaceous cyst. It occurs only in line of fusion. It can occur everywhere except in palms and soles. Skin is not adherent, whereas it is adherent. Subcutaneous plane does not extend to the deeper plane, it extends. Punctum is present in 70% of the case, it is usually absent. Freely mobile, there is no bone resorption. The bone resorption will be present. A superficial swelling and mobile, with it will be restricted mobility. No radiological evaluation is usually required. Need proper evaluation of CT scan and MRI. Excision is usually done under local anesthesia, but it is done under general anesthesia. The investigation is usually clinical, ultrasonography if required, and histopathological confirmation after the excision is required. Treatment include complete surgical excision of the cyst along with the sebaceous gland, surgery preferably in non-infected stage, complete removal of the cyst wall and gland prevents the recurrence. In infected cyst, incision and drainage followed by delayed excision. Telescrotomy is commonly employed when sebaceous cysts occur on the scrotum, allowing the removal of multiple cysts with acceptable cosmetic outcome. So to summarize, a sebaceous cyst is also known as wen. It is a true retention cyst of the sebaceous gland. Contents are sebum, not keratin. Sebaceous glands present in the cyst wall. Commonest site is scalp. Paget's test is usually non-transluminant. Punctum represents a blocked sebaceous cyst present in 70% of the case. Demodex folliculorum is implicated in the duct obstruction. Complications include sebaceous horn and Fox peculiar tumor. Telescrotomy is useful for scrotal sebaceous cyst. Treatment include complete excision with the gland. I hope you have learnt from this presentation. Thank you for watching.